And we begin with developing news tonight. Good evening, everyone, and thank you for joining us here at Western Mass News. I'm Sarah Grinelli. A new strain of COVID-19 virus is here in Massachusetts, and it's the same variant initially found in the United Kingdom weeks ago. Western Mass News reporter Lindsay Kane is live in studio with more. Lindsay.
Sarah, the Massachusetts Department of Public Health says a Boston woman in her 20s tested positive for the COVID-19 variant, making her the first case here in the Bay State.
It's easier to pass from person to person.
The Massachusetts Department of Public Health announced on Sunday that the first case of the COVID-19 variant, originally discovered in the United Kingdom, has made its way here to the Bay State. The DPH says a Boston woman in her 20s tested positive for COVID-19 in early January after coming back from the United Kingdom. A laboratory sample came back Saturday night confirming she has the variant. To date, the Centers for Disease Control and Prevention has reported 88 cases from 14 states across the nation.
With something like that, it is really hard to stop it, and we were probably going to end up with it here anyway.
Dr. Erica Hamilton in the microbiology department at UMass Amherst tells Western Mass News the variant isn't more severe, but it is more contagious.
It actually does not seem to be making symptoms worse. Because it is more transmissible, it increases your chances of getting it. And for some people who are much more susceptible to severe illness from this disease, it could be more dangerous for them in the end.
But she says the vaccine out right now will still protect against the new variant.
The spike protein on the outside of it that the vaccine is for isn't what was changed. It's a different quality of the virus.
Although the new strain is easier to pass around, Hamilton says there should be no immediate changes to any coronavirus restrictions across the state.
If we start to see a lot of it, we may see changes in our current precautions that we're doing. But if it only crops up in a couple of people or in very isolated areas or in certain concentrated places, then it may not change. So it really depends on how prevalent it becomes.
Hamilton says people should continue social distancing, wearing masks, and washing their hands. Live in studio, Lindsay Kane, Western Mass News.